Hi everyone, this is Dr. Chaitra from Kalpa Clinic. Today we'll be discussing a very commonly asked question or topic about vaginal discharge. World over, the most common inquiry that gynecologists face is that, ladies come and ask us that we have white vaginal discharge or vaginal discharge. Is it normal? Does it require treatment? Some of them may come with itching, some of them may come with foul smell, etc. So we'll know a bit more about what should be done and what are the causes for vaginal discharge. So there are 4 common reasons why you may have vaginal discharge. The most common and the most normal would be due to hormones. So most ladies or most girls between the ages of 15 to 45 years have regular menstrual cycles, and just before or after the menstrual cycle, you notice that the vaginal discharge increases. Normally, it should be clear, it should be non-foul smelling, and in the initial first half of the cycle, you can actually stretch the discharge. The second part of the cycle, it becomes more gummy, and unfortunately, you will not be able to stretch it. That's because of the normal hormones of estrogen and progesterone, which causes changes in the vaginal mucus. What is the second important cause? The second important cause which requires treatment and rightly which you should be approaching a doctor for is because of infection. Usually when you have infections, the common reasons that you could have infections are if you have sugars, high sugars in the body, or you have had a recent change in the sexual partner, or some such similar incident would have happened and your discharge changes. Normally, which was clear, non-foul smelling, becomes somewhat curdy, it becomes foul smelling, it may even have colors, like commonly there may be a greenish tinge or a yellowish tinge to the discharge, or sometimes even a reddish discharge may be seen. So in any of these causes or any of these things are seen by you in the vaginal discharge, it's important that you meet your gynecologist for the required treatment. Sometimes both you and your partner will be required to have the required treatment rather. The third reason why you will have a change in your vaginal discharge would be if the doctor has prescribed some medicines. Commonly, you'll have a fever or you'll have a sore throat or something of that sort and you'll be put on antibiotics. Unfortunately, your vagina has also got something known as commensals, or in common terms, I would say the good bacteria. And these antibiotics will also kill the good bacteria, so your nature of the vaginal discharge changes and you have an increased chances of having fungal growth in the vagina. So the fourth common reason which we often forget is if you have had any recent sexual activity which will cause a change in the vaginal discharge. So do remember that there are 4 reasons for vaginal discharge. Quite a lot of them are physiological. The most important which requires to be treated is if your vaginal discharge is because of any infection. Cheers.